Hello, my name's Caitlin Canning. Here's my little reference card. Today I'm going to be discussing polycystic ovary syndrome. This is a very near and dear illness to my heart. I was diagnosed when I was, 18 or 19, and I think that it is very under-addressed in females. It's not talked about very frequently, and it's honestly very challenging because there's not a lot of treatments for it. And I always like to read about it probably annually to re-educate myself on things that could be happening in my body and looking at updated journal entries because I feel like there's not a lot of research on it, and I think that it's important to keep up to date. So as I said, polycystic ovary syndrome is what I will be talking about. It is an endocrine disorder. And it is under the syndrome of polycystic ovary syndrome. So it's classified in the endocrine family. So being that it's an endocrine family, it is a hormone disorder where the female body produces excess androgens, which are male sex hormones, and that causes fluid-filled sacs or cysts to be grown on the ovaries. Common causes of this are actually unknown. It is more common in women that are obese or have insulin resistance. It could be inherited. So if your mother or your older sister has it, you're more likely to have it than someone who does not have any family history of PCOS. Let me flip over to my reference card. The ways that this can be diagnosed, it's a lot of clinical picture. So your provider will ask you your signs and symptoms, which can include your symptoms are going to be very severe menstrual cramps or cramps in the lower abdomen. You can have some missed menstrual cycles or irregular menstrual cycles or very heavy menstrual cycles. So they can kind of be all over the place. You can have oily skin and acne, and then signs, again, would be irregular periods, excess dark hair growth. So if you think back to the fact that it is caused by an excess of male hormones, that would make sense as to why there's thick hair growth a lot of times on the face, sometimes on the chest, just in areas that females don't typically grow and don't typically want to grow hair. You can have excess weight gain or major weight fluctuations, which is something that that was one of my main symptoms. But it's typically weight gain in the lower abdomen, in the hips, and then a lot of times in the face. I sometimes think of steroid symptoms when I think of polycystic ovary syndrome because it is hormonal. And then, of course, cysts on the ovaries, and that can be, I'm jumping into diagnosis, that can be diagnosed with ultrasound. So there are two different types of ultrasounds that you can do. There's one that is external, where your provider will take a look at your uterus, your ovaries from the outside, and that's kind of like on top of your pelvis. And then there's a transvaginal ultrasound, which they actually insert the ultrasound probe inside, and they can get a better look at your ovaries close up and the size of the cysts and everything like that. It is not comfortable, I can tell you that. And then a physician can also order some labs, and they will check your hormone levels. They'll check your sugar levels. Sometimes they'll check your triglycerides and cholesterol, and then other times they won't. But like I said, it's more a clinical picture. So if a patient comes in and they complain of, let's say, 3 of the 5 symptoms, and then they get an ultrasound and there are cysts, there could also be no cysts, but their blood levels do indicate that this person could have excess androgens, they will typically be diagnosed. So it's not like a blood marker where, or a blood pressure type of issue where you get your blood pressure taken 5 times and your blood pressure's high. It's more of, you got to look at your patient, you have to look at their symptoms, get some lab results, and then all of those combined will lead to a diagnosis. The treatment of polycystic ovary syndrome is very few and far between. There are not many things that can be used to treat. It's a lifelong illness, and the treatment is actually just symptom management. So It's a little bit tricky because birth control is something that providers will provide very frequently for people with PCOS. And that can be kind of a catch-22 because a lot of your blood controls, when they are hormonal, when they have estrogen, that can cause blood clots and a lot of other health issues for women. But progestin sometimes doesn't cut it. So birth controls, you can take a diabetic medication. So if you have insulin resistance, maybe your doctor will prescribe you metformin, which is a long-acting insulin medication, or something like Ozempic, which is frequently talked about in today's society, but I believe that it's called semaglutide, and that is also a long-acting diabetic medication. And then another thing that you could do if you don't want to be put on hormones or you do not qualify for an insulin resistance medication, you can change your diet and exercise. I have seen a lot on the internet recently about PCOS diets and how to cure your hormones with diet. Some people believe in it, some people don't. When I brought it up to my provider, she was a little bit hesitant and didn't seem to think that that could be a huge contender. However, if obesity is a cause, maybe a change in diet and exercise can help with your obesity, and then that can help with your PCOS. Some complications, of PCOS could be infertility, which is really upsetting. You can have no ovulation, which I guess would lead to infertility. You can develop type 2 diabetes, some vascular diseases, high blood pressure, uterine cancer. So you're at a higher risk for a lot of these complications that can lead to a lot of health problems. A differential diagnosis that I did want to bring up is endometriosis. Endometriosis, I think, or at least in my opinion after researching both of them, seems to be a little bit more severe than PCOS because the pain seems to be worse from what I've researched. But a lot of the signs and symptoms are the same: irregular periods, heavy periods, severe menstrual cramps, lower back pain, kind of the same symptoms, but endometriosis. A little story that I like to share, and it was when I realized that I likely had polycystic ovary syndrome, was actually when I was donating blood. So I had noticed I had very irregular periods. I had very heavy menstrual cycles for the first 2 days where I would be so exhausted and could barely function. I would be exhausted at school. My daily routines were thrown off, and I frequently donate blood. So when you go to donate blood, they take your hemoglobin levels. My hemoglobin was frequently in the high 12s to low 13 range, and I went to donate blood on one of the first days of my cycle. They took my hemoglobin, and it was 10.1. And I remember sitting there thinking, wow, this is why I'm so exhausted, because I lose so much blood in the beginning of my cycle that my hemoglobin drops up to 2 full points, and I wasn't able to donate. And I just felt like that was a very eye-opening experience for me and a very eye-opening way for me to kind of give myself a break. I am an ICU nurse, so I have a hard time sitting still, not being active. I love sports. I love exercise. And I was constantly beating myself up for taking it easy on the first day of my cycle. And when this happened, I was very made aware of how this actually has an effect on your body and the way that it operates. So like I said, polycystic ovary syndrome is, in my opinion, understudied and underdiagnosed. And I think that it's something that should be talked about more because I think for a lot of women, hormonal and reproductive disorders can make you feel very isolated and alone, and like no one talks about it or goes through it. So I was very excited to bring light to this disease and talk about it and learn about it more because like I said, things change very frequently in the medical world, and it's important to stay on top of your own health and do research and learn how you can best take care of your body. So thank you for listening. I really enjoyed making this, and I hope you enjoy.